How many of you were taught how to use stick moxa while you were in school? I can bet a lot of you, because stick moxa is probably the most common form of moxa taught in TCM education. There's one little problem though. These stinky little suckers are not only extremely smoky, but they're very hard to use in most clinical situations. And on top of that, they're really slow to use, and they're not super effective when it comes to moxa treatment in other forms. So today, I'm going to teach you how to take this stinky little stick of moxa and turn it into an ultra tonifying, extremely beneficial tool. So stay tuned. We're going to get into it. So I actually learned how to use stick moxa like this, which I'm going to teach you, in combination with salt and ShinKyu in my school at Toyo ShinKyu Senmon Gakko. Now when I first saw it, I was like, wow, that's pretty amazing. And it feels absolutely wonderful. So don't get me wrong, this is not my invention. This is something that I learned in school, and so I'm just trying to pass on this information to you, which by the way is the whole purpose of ShinKyu University. So if you love that purpose and you're on board with learning more about Japanese acupuncture and moxibustion, please do not forget to hit the like, subscribe, and the little bell to be notified of future videos coming out all about Japanese acupuncture and moxibustion. Also, if you are interested in learning more about this stuff on a one-to-one basis and in a community format in a lifetime mentorship program, don't forget to check out the link to ShinKyu University, which is in the description box below. All right, let's get into it. All right, now in order to create this ultra tonifying stick moxa, you're going to have a few things on hand. You're of course going to need your lighter. You're going to want an ashtray filled with water. If you can see, I have some water in here. You're also going to want a box cutter. You can just use a razor blade, but I prefer a box cutter just to be safe in my hands. Salt, your stick moxa, of course, just a regular old variety. This isn't anything special at all, although you can get higher quality stick moxa so it doesn't smoke as much or smell as bad. I also have a bamboo holder here. This is not necessary, but definitely helpful. So what this is a piece of treated bamboo. And then I've actually glued a piece of gauze onto the bottom of it, which has been used several times. As you can see, I probably should redo this sooner or later, but then you can put a piece of clean gauze in between this and your patient if you're worried about it being a little dirty. And then you're going to need some ShinKyu grade moxa. So now that we have all of the things on hand, let's begin. Now, before I go any further, I would really love to know if you've learned how to do salt moxa in school, and if you've learned how to do something similar with your pole moxa. Please comment in the comments below. I'd love to learn more about your experience and how you learned in school, so I can get a little bit better taste of different educational models across the globe. All right, so one of the very first things that I'm always going to want to do with this is I'm going to take my box cutter and my pole moxa, and I'm going to cut about 1/4 of an inch or so. The pole moxa in about 1/4 of an inch strips. So I'm just going to go ahead and do this, and you can cut as many as you would like. Usually when I do this, I try to just cut a whole stick at once, simply because I'm a little lazy. Just for today, we're just going to cut one. So we have our little 1/4 inch strip. Doesn't have to be perfect. All right. Then we're going to take our little holder here. Now, of course, you can just put gauze. And, you know, I'm sure you learned in school to put salt moxa on the belly button or on Ren 4 or on Do 4 and to do an ultra tonifying, ultra warming treatment. I'm going to be using this bamboo holder simply because it is so much easier if the moxa starts to get too warm from them to just simply pick it up and take it off. So it's a really, really easy, quick trick, nothing that takes a lot of skill, really. Then I'm going to be taking my 1/4 inch strip of stick moxa, and I'm going to be placing it right there in the center of the salt. Now, I've only put a little bit of salt here. I would say maybe less than 1/4 of an inch tall salt on here. You can, of course, put more salt, but again, the more salt that you put in there, the harder it's going to be to warm up, right? And so you're really going to want to just decide how much you want to warm this person up, because if you can warm up like a 1/2 inch of salt, then it's going to stay warm for a lot longer, but it's also going to get a lot hotter. So you have to just decide how much you're willing to do. And then we're going to make some ShinKyu cones. Now, if you're unsure about how to make a ShinKyu cone, you can check out a link for that up here. I'll link that to a previous video I did a while back about creating a ShinKyu cone. And then I'm going to take my ShinKyu cone, and I of course can make a few of these if I wanted to. And I'm actually going to put it right on top of the stick moxa. So as you can see, the ShinKyu is just sitting right on top of that 1/4 inch strip of stick or pole moxa, whatever you want to call it, and then on top of our salts. So now we have a pretty low grade moxa. Yeah, so the inside of this is a nice bright yellow color. So it's not a terrible moxa. When you look inside your stick moxa, the browner this is, the lower grade of moxa really it is. So it's going to give off more smoke. And then you have your ShinKyu cone, and of course you can do several cones. And then we're going to take our lighter, and we're going to go in, and this might be easier with an incense stick, just to let you know. We're going to go in and we're going to light our ShinKyu cone. And so what this is going to do when placed on the belly of our patient, either on the belly button again, Ren 4, or maybe even Do 4, it's going to really be an ultra tonifying, really easy technique to warm up your patient, help them feel more comfortable when they are really deficient or really have a lot of chronic cold in their belly. Now, things that you're going to need to know in order to understand if they have chronic cold is, of course, using your hands to do your palpation. Now, another really important thing about if you're going to be using something like this bamboo holder is that, of course, when someone laughs or when someone talks, it's very easy for this to fall off of the client. So it's just like when you're doing any kind of moxa with your client, make sure that you have a towel or even like a pillowcase that's wrapped around this, so in order to secure it on the client, and also it kind of covers the client's belly to really keep them warm. Now, it's a super tonifying, really warming technique. So this is where I highly suggest that before you do this technique that you really understand with both your palpation, of course, but also with your pulse taking, that you understand that your patient really needs this kind of ultra tonifying technique, because one of the biggest rules of our medicine, and any medicine really, is that you don't harm the patient, right? And if you're over treating, you can harm them, and over tonifying someone can also harm your client. So as with all techniques, make sure that you definitely try this out. If you've tried the salt moxa before in class, then you probably know at your school that this salt moxa can be really warming for the belly. I highly suggest with the ShinKyu and then also with the pole moxa on top of it, try it out on yourself first, and also, try to wrap that sheet around it so that way it's, especially if you're using a bamboo holder, right? And make sure that you're covering, if you're just putting the salt on the belly button. I highly suggest not putting the salt straight on the belly button because it's just uncomfortable. So if you even just put a piece of square gauze underneath it, it'll be easier for it to take it off in case it's too warm for them. Any case, try it on yourself first. See if you like it. See how much it tonifies you. See how many ShinKyu cones you need to do, because as I said before, this might not be enough warmth for some people. You might be able to put another fourth of a stick of that pole moxa and then ShinKyu on top of it again. So, I just really highly suggest that before you start using it on clients, that you test it first on an inanimate object. You understand how it works and how you need to utilize your hands, then test it on yourself so that you understand how it feels, and any mistakes that might be made along the process, you make everything seamless and really beautiful and as close to perfection as you can, and then you test it on a client, because we never ever want to hurt our clients, and I would hate for you to accidentally, for example, knock the salt moxa over and accidentally burn your client, which is always a possibility, right, with our moxa. So you always want to be really careful. Make sure that you have informed consent in both paper and in writing, of course. It's really important for our patients to understand what we're doing for them in order to help them, and that they're okay with that. So that was all about taking our very stinky and very smelly and very smoky pole moxa and just changing it a little bit so that it's not quite as smoky, it's not quite as smelly, but it's actually making a lot more powerful treatment for our clients and really being ultra tonifying and ultra warming to the system. Thank you so much for coming today to take your time, energy, and effort to learn Japanese moxibustion with me here at ShinKyu University. If you're interested in this content, I highly suggest going to the description box below and clicking on the link to set up an interview to see if lifetime mentorship and membership into ShinKyu University to learn little tips and tricks like this one and bigger things that can help you create more confidence in your treatment and more powerful treatments is right for you. Again, that's in the description box below, and there's also a link for my free webinar down there. I highly suggest you checking out. Please don't forget to like, subscribe, and hit that little bell to be notified of future videos coming up in the future, all about Japanese medicine, moxibustion theory, and so much more. And if you're interested again about learning that Chinetsu, please do check out this video over here. It's a great little video to teach you how to utilize your Chinetsu. And if you're interested about how mentorship really can be the key to your success, check out this video over here. Thank you so much for watching. I really enjoyed our time together, and until I see you next time, happy practicing.